Welcome back. You're still watching the UBC News, broadcasting live from Nile Avenue. Busongora County North in Kasese District may appear lush and fertile at first glance, its rolling green landscape suggesting abundance and the ease of life. But beyond the scenery lies a different reality. Communities here face steep terrain, limited infrastructure and long distances to essential services, making it one of the hardest to reach areas in the region. At Rwesande Health Centre IV in Kalisya, that challenge is felt every day as residents struggle to access even basic health care. This is the story of a place where beauty masks the burden of access and where getting help is often the hardest journey of all. Let's take a look.
Access to essential services remains a major challenge for communities in the mountainous North Busongora County. Poor road networks, inadequate health services, limited access to clean water, and unreliable electricity continue to hinder service delivery. Musoki Joan, a young mother from Kichwamba sub-county, is forced to walk several kilometers to return her sick child to Rwesande Health Centre IV for review. The child had earlier been diagnosed with stomach complications and referred to Kawarore Regional Health Referral Hospital for an X-ray service. Writes Reverend Nason Baruko, the Bishop of South Rwesande Diocese. The founding board of Rwesande Health Centre IV has unveiled plans to upgrade the facility to a hospital status. This, he says, will address the growing demands for specialized healthcare services in the region.
My appeal to government, my appeal to companies, my appeal to NGOs and individuals and all well-wishers to join us in the campaign so that we see Rwesande Health Centre IV be upgraded to a hospital.
The bishop notes that the absence of radiology unit and other specialized services remains a critical gap.
But then when we had the assessment for the facility, it was realized that there was a gap in terms of acquiring an X-ray. When we looked at the cost of the X-ray, it was too much, but then we said, yes, we have the people. Let us bring people together.
Dr. Muhindo, a senior medical officer at Rwesande Health Centre IV, highlights the urgent need for specialized services and personnel.
Basically, Rwesande is a church-founded institution under Church of Uganda, serving a rural population of around our catchment area is around 300,000 people.
Dr. Isaac also points to the difficult working conditions caused by the area's terrain, but says he remains committed to serving his community, describing this profession as a calling. Dr. Joseph Omo, a senior medical officer from the Ministry of Health Emergency Support Services Department, supports the call to upgrade the facility, citing the area's geographical challenges and growing healthcare needs.
We had difficulty reaching here. The terrain was really difficult, and I guess this is what the patients go through daily. And we had to walk for about 1 kilometer on foot because the vehicle could not move fast.
To support the upgrades, the South Rwesande Diocese has organized a fundraising drive aimed at acquiring a fully equipped radiology unit. The chairperson of the organizing committee, Engineer Samson Bagonza, says approximately 300 million shillings is needed to establish the unit.
The dinner will be hosted by South Rwesande Diocese to raise 300 million shillings that is required to set up a radiology unit at the health center. Now, setting up of this radiology unit is a requirement for Ministry of Health, such that the health center qualifies for upgrade into a hospital.
Story compiled by Stephen Kalisya for UBC News.